and welcome. You're watching Yashoda Hospitals, the Health Talk session. The occurrence of brain tumors in India is steadily rising. Timely diagnosis and treatment will prevent further complications. It's important not to ignore your symptoms and consult a specialist as soon as possible. So let's discuss about brain tumors and more in our today's episode. I'm Dr. Lakshmi, and joining us today we have with us Dr. Venugopal, consultant neurosurgeon from Yashoda Hospitals, Somajiguda. Welcome, doctor.
This is Dr. Venugopal. I'm a senior consultant neurosurgeon, Yashoda Hospitals, Somajiguda. My prime areas of interest are the brain tumors, skull-based tumors, vascular. I do a lot of aneurysm clippings, and I do a lot of spine work. I do minimal invasive spine surgeries.
That's nice, doctor. So we are here today to discuss about brain tumors in our today's episode. So the exact reason for the occurrence of brain tumors is still not established, but I'm sure that there are few factors which contribute to this. Could you elaborate on this more, doctor?
In kids, usually they have associated genetic responsibilities in the form of some syndromes are there, or previously then the kids are exposed to some kind of radiation. So eventually they may end up in having other brain tumors. Whereas in adults, we specifically don't have any specific reason. But in some of the patients who have associated type 1 neurofibromatosis and type 2 neurofibromatosis, so these kind of genetic things which are there, they are definitely prone for more brain tumors in the form of parenchymal tumors, some of the skull-based, dural-based lesions, some in the form of neurofibromas, and at the same time meningiomas are more common.
So discussing about symptoms, doctor, most of us know that headache is one of the most common symptoms. So apart from this, what are the other signs that one should look out for?
The most common, as we know, the patient comes to us with a headache, but all headaches doesn't have the features of brain tumor. There are some specific red flags whenever a patient comes with a headache, which we specifically look into it. Headaches which are more common in the early mornings, which are associated with vomitings and which are projectile in nature, and they should not have any, usually nausea should not be associated. Second thing is associated with the patient can have visual blurrings in the form of the patient starts losing the clarity of vision, and at the same time sometimes the patient complains of double vision. So these are usually, these three complaints usually are associated with the form of raised intracranial pressure. And the other thing is that again the patient symptoms depend on from which part of the tumor, which part of the brain the tumors are coming from. For example, when the patient is having a tumor in the frontal part of the head or frontal lobe, so usually the patient will have more of, change in personality. The patient who was initially jovial and happy-go-lucky guy and starts becoming dull and will not be looking, he'll become apathetic in the form of like he will start losing his emotions, and gradually he'll become dull and depressed. So these are one of the factors also which you should look into it. And some of the patient will have some memory disturbances, and gradually if we go back, and at the same time if it is in the anterior skull base, the patient will start losing his smell. And if the tumor goes behind, even he will have eventually he will start losing his vision. And another important thing is, if we go into the most of the posterior part of the frontal lobe, the most common symptom with the patient comes to us is he starts becoming weak on one half of the body. So these kind of usual symptoms in the form of visual symptoms like starting from the headache, vomitings and double vision, losing memory and having seizures, becoming one part of the body becoming weak, and having mood fluctuations, memory disturbances and personality changes, visual hallucinations. So all these symptoms usually are a part and parcel of the brain tumors which a patient comes to us with.
Yeah, so you mean to say that the symptoms depends on which part of the brain is really getting affected. I think that's interesting. So usually, doctor, brain tumors are diagnosed by CT and MRI imaging. What are the recent advancements for diagnosing brain tumors, especially in the early stages?
Now, with the advent of latest CAT scans and MRIs and functional imagings, so now there are different investigations which have come. So the investigations vary from the level of X-ray, but as we have a CT scan, we start from the level of CT scan, which is with plane and contrast. Now we have a 128 slice CC and 256 slice CT, which gives a good amount of thickness and thinness of the level of cut we get, and from the cut we can see more information. So next comes with the MRI. In the MRI, again we have different kind of sequences which tell us more, it gives more information about the tumor in its different sequences. And in MRI again we have something called as MR spectroscopy. This MR spectroscopy will give us the contents of the tumor. So based on that we will know, we can, looking at the MRI we can see the grade of the tumor. So that is the one which will help to for the prognostication of the tumor. And coming on to the next thing is they have something called MR perfusion. MR perfusion is another important thing which will tell us the kind of metabolism which is happening in the tumor. So this is there. And next is a functional MRI, because the most common the complaint or the problem the patient usually says, it is like after surgery, is he going to become kind of hemiparatic or the paralytic, or is the damage going to be permanent, or will he be able to speak, will he be able to understand or recognize everything how he was there before. So when the tumor is near to the functional area, so we have to do something called as functional MRI to localize how far our speech area is located with relation to the tumor, or how far the tumor is with relation to the hand and leg area. So based on that we know, so how much area to touch and how much area to leave, all this information which we can get beforehand. And there is anything which we have something called as PET scans have come. This PET scan will usually tell us if the lesion is single, it's more of a kind of glioma. If it's multiple lesions are there, we have to think of a kind of metastasis where we have to work up with the rest of the body.
So with such evolved technology, what are the recent advancements in treating brain tumors?
Coming on to the neurosurgical aspects of the things which are there in the operation theatre, one is the navigation. This navigation helps us to localize the tumor with relation to the skull. So previously with relation to the, we used to draw some lines on the skull and with relation to where exactly is the tumor. Now we are not leaving anything for imagination. If we are trying to cut something on the, put something on the skull, or we are trying to cut something or cut some bone on the brain, so it has to, we need to be sure that the tumor is just below that. So to get into the tumor, we have something new technology in the form of high speed drills. The high speed drills have an RPM of almost around 1 lakh RPM. It can range from 75,000 to 1 lakh RPM, and beyond that usually the bone gets cut like a cake, and from there we can enter the tumor. And once we enter the tumor, we have something called as microscope. Previously the microscope has only magnification and illumination, but here what happens is we don't want just magnification illumination, we want even the functional aspects which are happening inside the in and around the tumor. So this microscope gives, with the help of fluorescence and immunofluorescence and all these techniques, we can even tag the tumor, make the tumor glow, and exactly we can cut the tumor which only when the tumor is there, not exactly the surrounding brain. And next, coming on to the once we take the tumor out, so then what we have is, there is something called as, recently there is a new thing, has intraoperative radiotherapy has come, and next is something called as, we have intraoperative neuromonitoring. This is another important thing which has come, because previously when we operate and by the end of surgery the surgeon sees that the patient is not moving hands and legs, then the chance of paralysis has increased. So during surgery itself we don't want to be having a surprises for the patient as well as the doctor. So during surgery we will get kind of real time information what exactly the nerves we are dealing with, what kind of nerves we are cutting. So this gives that information. So based on that we can clearly stop the surgery there, or we can modify our surgical plan and all those things. So with this the chance of paralysis can be decreased. And the next thing which is something called as IMRI. The IMRI is an intraoperative MRI, so which will tell us whether the surgeon has completely taken out the tumor or not, has there any residual is there. So in this aspect the kind of amount of radiation chances and recurrence all can be reduced if somebody has an access to this intraoperative MRI.
So with such technological advancements, especially in the field of neurosurgery, you mean to say that the patient recovers faster and can be discharged home earlier, doctor?
The kind of incisions which we are giving now, they're almost come down by around 70% the incision. So obviously the recovery will be much faster. The patients who choose to get discharged around 10 days or 14 days, now we hardly discharge in 4 to 5 days.
So before ending this episode, doctor, what message you would like to give to our audience out there?
So being a neurosurgeon, and if the patients are concerned, the people who are concerned about to know more about the brain tumors. So as I said, that the kind of lifestyle which we are having, the kind of things which we are having here at the moment, we will be exposed to more of this kind of environmental pathogens through which we will have kind of maybe malignancies or some kind of thing. So try to maintain a good lifestyle, eat a balanced diet, try to not to eat all the junk food, try not to take a lot of trans fats, and try to get into kind of regular healthy lifestyle, having a good kind of exercise, good sleep. So these are much, they are more, people are think that they are much, they have to go to a gym and all these things, but they are the mandatory things which people have to do to have a good quality of life over a period of time.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you for having us.
So this brings us to the end of this episode. We've been discussing about recent advancements in treating and diagnosing brain tumors. Hope this episode was informative, and don't forget to join us for the next week as well. Until then, stay healthy and take care. Thank you.